injections. These are frequently done in the Asian literature for reduction in the facial width or facial volume in the masseter region. Those take a sequence of injections, but one of the other great areas that we have found is people who, they typically use mouth guards or complain of biting or tense jaws. It works extremely well for those. So it's usually 4 or 5 injection points, usually kind of like a dice, 4 or 5 areas. Highest, most or widest portion of the masseter muscle. When people are clenching, effects take place usually within a week, and then they can last 4 to 6 months in most of our experience. So it's pretty quick, very straightforward to do, and particularly the patients who suffer from severe biting or clenching, they really benefit tremendously from it. So we're going to inject along the masseter area. Our patient clenched really tight. You can see where her maximum projection point is right about right here. So we're going to keep her nice and clenched, and we're going to go straight on in, pinch, 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 one more pinch. There we go. And my usual dosing is starting out at 20 units of Botox or between 50 and 60 units of Dysport per side, and then we adjust based on how the patient responds to that. That's one side. All right, so I'm gonna have you clench down for me again, so I can feel the entire masseter. And where somebody's maximum projecting point is, hers is over here on this side. It was a little bit more anterior on the other side. Pinch. Pinch, 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 pinch. Done. All finished. So this is Dr. Paul Ruff at West End Plastic Surgery, and if you have any other questions about masseter injections or any of our other services, don't hesitate to visit us at www.westendplasticsurgery.com, or you can call for an appointment at 202-785-4187. We look forward to seeing you.